this is a 2-week protocol for a Myositis Ossificans injury in the thigh. The first few days are going to be a lot of modalities to try to control the pain and also break up the calcification that has already started to form. Day 1, we're going to start with IFC 8150 with ice with the quad on the stretch to try to control their pain and also to keep this area where the calcification is, to keep it stretched to try to help it from not becoming more. Then we're going to do phonophoresis with a 2% acetic acid solution, and that's going to be for 8 minutes. Then we're going to complete a therapeutic massage for 10 minutes, just around the whole area. Be careful with their pain level. It's going to hurt a little bit because of what's there, but try not to make it excruciating. Then we're going to do some just basic stretching, quads, hamstrings, hip flexors, everything surrounding the area. And then lastly, we're going to do joint mobilizations at the hip, anterior and posterior. Just go through a couple of those each time. Okay, day 2, we're going to start with the IFC again, 80 to 150, with ice and the quad on the stretch for 15 minutes. Then we are going to do shockwave therapy, which is sort of like a hyped up ultrasound where you still use a gel and you'll do it over the area, and it sends shocks at a high intensity into the body to try to break up whatever's there. So that's why we chose to use it on this ossificans, because it has already started to calcify and we want to break it up as soon as possible. And then lastly, we're going to do I'll go through all the stretching again for the quad, hamstring, and the hip flexors. Do about 3 for 30 seconds each on that one. Day 3, start with the IFC again. Do another session of the phonophoresis with the acetic acid. Therapeutic massage for 10 minutes. Again, the whole area. Go through the basic stretches again and the joint mobs for the hip. Thursday is going to be sort of like a rest day, just to give their leg kind of a break from everything, but we're still going to be doing the IFC with the ice, with the quad on the stretch. Continue that. Continue the basic stretching to keep their range of motion up when they still can't really do anything. And also, after they're done that, after they've been moving a little bit, we're going to compress the area and do stim again before they leave to go home. That's it, Brendan. Okay, Friday, day 5, we're going to continue with the IFC, another session of the shockwave therapy, basic stretching again, therapeutic massage for 10 minutes. And then Friday, Saturday, and Sunday, we will be doing seated leg extensions and body weight squats for this. Just as seen, just simple, nothing too complicated yet. And you can base this on their pain level, how they're feeling when they're doing that, if it's okay to do. Saturday, for the modalities, we'll be doing the IFC with the phonophoresis after that with the acetic acid solution, and joint mobs again that day with the leg extensions and body weight squats. And then Sunday, which is the final day of the first week, we'll be doing the shockwave therapy again, the IFC with the stretch, the other stretches, continue with the massage, and the squats and leg extensions again. Okay, starting with week 2 of this rehab protocol, days 1 through 4 of week 2 are going to be very similar with each other. We're adding in a bike for warm-up at the beginning of each session, about 10-15 minutes. Continue with the IFC. We're going to alternate ultrasound and the shockwave therapy treatments every other day for the first 4 days. We're going to continue with the stretching, and for the therapeutic massage and the joint mobs, we're also going to alternate on the first 4 days. Then we're going to continue with the body weight squats, and with the seated leg extensions, we're going to add in an ankle weight. And you can increase the weight as the week goes on. For Friday, we're going to continue to do the bike for the warm-up, IFC, we're also going to try to do the Graston, start with Graston on the area. You can kind of depend on how the athlete is doing at that time if you think that would be appropriate. Continue with the stretching, squats, seated leg extensions with the weight. Then today we're going to add some sport-specific activity, so they will do the ladder drills. You can do forwards, backwards, sideways. Just make sure you're getting both feet in each space. And then we are going to finish with a ball handling drill, which is just kicking the ball back and forth between your legs, just to get used to the feel of it again. Saturday, we're going to continue the bike warm-up, the IFC, last session of the acetic acid phonophoresis. Keep doing the stretching, squats, leg extensions, ladder drills, and the ball handling drill. They can do some jogging to see how that feels, some quick sprints as they're working towards returning to play. When they do return to play, they're going to have to use padding such as this to place on the thigh and wrap on to protect that area from getting injured again, getting worse, whatever it is, just to have something to protect it as they're playing again.